The numbers I'm looking at in 2021 gets me really worried, and the breakdown of these numbers also shows a spread more in the northern region of Nigeria. Can you tell us specifically what are the things you've identified as the major causes of these outbreaks in these areas?
Okay, thank you very much for having me. The key issues that have been identified is issue of water, sanitation, and hygiene. So the once Nigeria is a cholera endemic country. That means there are some areas where we have all through there, cases that are happening. So, but what we realize is that number one is issue of water. Potable, drinking water that is lacking in most of these areas that are affected. Number two is issue of the sanitation. For example, waste disposal, be it fecal waste, which we are really worried about, especially area of open defecation that we find ourselves in Nigeria. So many people defecate, openly. We are working hard with our other colleagues at Federal Ministry of Agriculture, Federal Ministry of Water Resources, and Federal Ministry of Environment to make sure that Nigeria is open defecation free, but we are far from there. So very few local governments now have become open defecation free out of 774 local governments. So that is one aspect that I know we need to work very hard, particularly the states need to work very hard. And then, of course, area of waste disposal, apart from fecal waste, even household waste, the way it is being disposed, it attracts a lot of rodents, and then, people also defecate where this waste is being deposited. So that's a very serious issue. And then simple thing that people, tend to overlook is issue of hygiene. Either it is hand hygiene or environmental, sanitation. People don't take it very seriously to wash their hands regularly. So basically, cholera is issue of water, sanitation, and hygiene. If we want to clearly, eradicate, cholera, or at least bring it to the barest minimum,
yes,
we have to take care of the, water, to have potable drinking water, and then environmental and, hand hygiene, and then environmental sanitation, and then, to reduce open defecation.
How do we ascertain the source of water we drink is okay? I mean, I just buy water, I just drink water. What else am I supposed to check for?
Yeah, so that is also an issue that we are on. This is an issue that the states are trying to handle because, we are supporting the states to handle this response. I was in one state in Nigeria where we had to actually close down a sachet water factory because the pipe-borne water that is coming to the factory it passes through, a very dirty, gutter, and it's leaking. So we had to really, the states have to enforce the environmental sanitation, and hygiene measures so that at least they'll be able to monitor, these environmental health officers that are supposed to handle those issues in the states, and local governments, so that they make sure that this water that we're taking from either sachet water or bottled water, is good enough for us to consume. So we're advocating to states. Any state we go, personally, the NCDC team has been deployed to most of these states that have cholera. And one of the things we do is to make sure that there's enforcement, of environmental sanitation, and then, personal hygiene, and to make sure that the pipe-borne water, the pipes that are, moving from the water plant where they produce the water to the community, is safe. Because the problem is that even if the water is being purified by the state, and being, the way it is being conveyed to the community. You understand what I'm saying? So some pipes are broken, as you said. So some sachet waters and bottled water may not necessarily be safe. So I think states are working on that with the support of the, stakeholders, as I said, the Federal Ministry of Water Resources, Federal Ministry of Environment, and then Nigeria Center for Disease Control.
Well, I'm not certain how much the work they're doing, how much is yielding results. I mean, but you can tell us about the response NCDC has put up to this outbreak of cholera across Nigeria. What's the response like? What do you do in the cases where we have this massive spread of cholera across the country?
Yeah, so thank you very much. The issue now is that the cases of cholera are coming down. When we talk of aggregate number, we know we have a large number of cases right from January 1st to date. As I said earlier, we have over 111,000 cases with over 3,600 deaths. So NCDC, right from the beginning of 2021, when we noticed, cases are being reported from states, so we activate the Instant Coordination Center. That is the ICC. So where we have stakeholders in place, and we developed what we call Incident Action Plan for Cholera. So we coordinate the response from the national level. And then we also train, zonal level training of cholera detection, reporting, and prevention to all the states in Nigeria. Now, having done that, we also deployed what we call rapid response teams to states where this cholera is being reported. So what this rapid response team do is, number one, they help the state in the active case search. That is, they search these cases because, as you know, once you have cholera case in a community and you are not taking care of that, it's highly infectious. So it can affect many people. So we help the state, we support the state to make sure that these cases are detected in the community, in the health facilities, and then they're taken to appropriate, treatment center where they can be, treated. So that's number one. Number two, we also supervise and make sure that the case management, component, that is where these cases are being treated. We have cholera treatment centers or units all across the states where these cases are being treated. Are they abiding by all the necessary infection prevention and control, procedures? Because, as you know, even where we are treating cholera, once we don't have the infection prevention and control measures like use of hand gloves, washing hand in and out before you go in, when you're coming out, and other things. So it can serve as a source of infection itself. So we make sure that we provide the necessary commodities that are needed for treatment centers. But as I tell you, the states are supposed to be the driving force in this response. So having said that, we also develop jingles at the national level, and we domesticated, the state domesticate those jingles on cholera so that they'll be airing them. And right now, many states are airing these jingles, to make sure that people are aware of how to prevent themselves from getting cholera.
Okay. So,
and they domesticate these jingles in local languages. You understand? So these are the things we are doing as far as, and then we also go out to enlighten people, when we visit these states. You understand? And then additionally, we also have vaccinations in some of these states. Like in Bauchi, we had, reactive vaccination, in Benue, in Sokoto, and some other states.
Let's talk about vaccination. You've mentioned this in passing. So is this vaccination preventive? Is it, can I just walk up to a hospital and say, I want to get vaccinated for cholera?
No. We have two types of vaccinations. We have what we call reactive vaccination and preventive. Reactive vaccination is when, you have an outbreak of cholera, like now. You understand? So you go to, areas that are hotspots. We call them hotspots where you have, a high number of cases. in that area, then you vaccinate that community.
Okay.
So that's reactive vaccination. That's what we actually do in those states I mentioned. States of Benue, state of there are about 4 states that we have actually done that.
Bauchi, Jigawa, Kano.
Yes, so but the issue is these vaccines also need to be done to almost general population as a preventive measure.
So why are we not doing that?
Yes, because the vaccines are not enough the world over.